This is an extremely important time in the African American community. 13% of the country, yet we wind up being 25% of the COVID deaths. And so without question, it is critical that this community, our community, be addressed as it relates to the COVID situation, and particularly the Delta variant. Now, this is an expanded kind of format tonight from what's been happening in our usual Wednesday time together with my congregation, but there are others joining from around the country, actually, pastors who have been in touch with their congregations and other persons who normally wouldn't be here tonight. And so we really want to spend time kind of demythologizing a lot of stuff that's out there. And I can't think of a better panel to do that than all of you. And this is going to be really informal. There's not a really big run of the show kind of thing. It's going to be very, very informal. For those of you who are watching and want to ask questions, you can put it in a chat, and you will be able to get answers to whatever it is that you are concerned about as it relates to COVID and Delta and what it's doing in our community. There's no such thing as a bad question. And whatever's on your heart, please feel free to ask it. We have attendees on this chat who are not only here, again, like I said, in Jacksonville, but they're all over the country. So you're going to basically hear from a much broader perspective than just Duval County. And I think the first thing is we need a kind of a lay of the land. And what I mean by that is, through your eyes, tell us what's being seen. Because we do know one of our most frustrating things we've all talked about is the disinformation and the misinformation. I think there's more disinformation than misinformation, actually. I think it's intentional. And so I think through your eyes, since you are there on the ground, and from the things you've already shared, I think people need to know just what it looks like. And they're in various different spaces. So I'm going to start, if you don't mind, and just ask from a pediatric standpoint, what are you seeing? What's going on? And how can you best communicate to those who are on tonight what you are actually facing with what you're going through? So Adriana, you and Ryan, of course, whoever wants to go first can. I will not in any way choose that. So sure. Whichever one wants to, that's fine with me.
My name's Dr. Adriana Cantville. I'm a pediatric hospitalist at UF Health. I'm also a mom of two young school-age children who are 4 and 6. Yeah. My husband, who's also a panelist that you'll hear from shortly, Ryan, is on the call as well. But what I'm seeing being on the hospital side of things is really, it's just, and as a mom also, more importantly, it is something that is so frustrating and is something that is so, to me, tragic, because we've asked our children time after time to bear the brunt of the weight of this pandemic. Early in the pandemic, we asked our children to make all kinds of adjustments to their learning, to their environments, what they could and couldn't do to protect our elderly, to protect older folks who were at risk. And they were so nimble and so wonderful in how they adjusted to virtual learning and how they adjusted to becoming really very isolated from everyone. And our society has failed our children. And yet again, they're bearing the brunt of this pandemic. And now they're the most vulnerable because they are, under age 12, not able to get the vaccine yet. And they're extremely vulnerable. And what we're seeing now, even as our state has surged with the Delta variant and has had numbers that have just crashed everything that we saw in the fall and in the winter of last year. And now we're seeing finally cases maybe starting to level off, except for the only group that's still increasing is children. And to me, this is just, it's criminal what we're doing to children, that our society isn't protecting our most valuable resource, that we're not doing everything in our power to keep our kids safe. So we're seeing lots of kids become infected. We're seeing more kids than ever requiring hospitalization. And now we're starting to see the kids who are having the complications like MIS-C, which I'm sure Dr. Gale can speak to, or long COVID, which somewhere between 10 and 25% of children suffer from long COVID complications. So we're only beginning to see all these complications in children.
Well, thank you. Thank you for that. Ryan, is Ryan on?
Yes, sir.
Okay, could you dovetail, if you don't mind, right behind what your wife shared?
Yes, sir. So I'm Ryan Cantville. I'm a general pediatrician at Jacksonville Pediatrics and the president of the Northeast Florida Pediatric Society. So as Adriana said, we've definitely seen a huge spike in COVID cases in the pediatric population. I won't comment on the hospitalization since she covered that. And then Dr. Gale from Wolfson's Children is on the call as a panelist too. So I'll let him talk about how what they're seeing as far as inpatient. As far as on the outpatient side, we're seeing a plethora of kids come in every day with COVID symptoms. And I think one misconception is, well, COVID's only this type of symptoms. COVID can be anything, right? Is your child's cough or cold COVID? Maybe. Is your child's headache or bellyache or anything else COVID? Maybe. So I think sometimes in the population, we've been lulled to, oh, well, that's not it. It's allergies. It's not that. I think that's how we continue to lead to spread. Oh, well, my kid doesn't have it, so I'll send him to school. And then, you know how that spirals out of control. So I think in our office, we're seeing and testing probably 40 to 50 children a day. And our positive rates coincide with the local positive rates in Duval County as they've been 25. Ours has probably been about that, as now they've gone down closer to from 20 down to 15. We're seeing that trend as well. Luckily enough, our office is giving out the COVID vaccine, which is our best friend right now, because you're seeing obviously the rates of hospitalizations on unvaccinated patients is skyrocketed. But I'd love to tap in Dr. Gale to chat with him about what he's seeing at Wolfson's and as an ICU attending.
Dr. Gale, please, if you could, sir, join in and share with what Ryan was saying about what he's seen and what you may see.
Right. But thank you very much. And it's a pleasure being here this evening on this illustrious panel. My name is Michael Gale. I'm the Chief of Pediatric Intensive Care at Wolfson Children's Hospital. And Adriana pretty much summed it up in terms of the effect that we're seeing in children in the community. But in the hospital, I will just address that specifically. When this pandemic started just over a year ago, we had very few kids with the typical COVID type symptoms in the intensive care unit or in the hospital for that matter. What we saw then was a condition called MISC, which is multiple inflammatory syndrome in children, which is a condition that presents maybe 10 days to 2 weeks after a child has been exposed to COVID. So initially, the child may not know that he or she has COVID because they have none of the typical symptoms. But about 2 weeks after, they present with heart failure, lung failure, and other system failures. So those were predominantly what we saw for most of last year. However, with this increased surge that we've seen recently, we have seen double the amount of children being hospitalized with the typical COVID symptoms and conditions on the pediatric floor, but also in intensive care unit. As I speak to you today, we are averaging about 5 to 6 children in intensive care with respiratory failure, kidney failure, and also we're now seeing some more of the MISC. And unfortunately, in the last 24 hours, we have about 2 children who died as young as 2 weeks of age. So yes, children will get less problems with COVID, but they do get some of the severe conditions, and we're seeing more and more of those in the intensive care unit. Unfortunately, even kids who could be vaccinated, some of our kids are over 12 and they could be vaccinated, and they unfortunately have severe pneumonia, and in many cases the parents are against vaccination. So definitely would like the audience to know that even though kids are getting COVID less percentage-wise, but with the increase in the kids going back to school, with some places do not having mask mandates, more and more kids are being exposed to COVID, and we're seeing more kids having severe organ failure with COVID, and unfortunately, some will die from it as well.
What I think it says something about us as a culture, that we would see children suffering like this and not do whatever we need to do to mitigate that. I think it's unconscionable, sinful, And in some ways, I don't think I'm embellishing it or using hyperbole. It's criminal, the way I see it, for children to be treated like this. I'd like to ask, before I move to the next section, I'd ask Dr. Johnson Foy, as a family practitioner, what do you see in terms of families coming in during this COVID season, Delta season? What are you observing? What's been your experience?
So it's very similar to what a lot of people are saying, especially with the children and the entire families. One of the biggest things that is happening right now is this misunderstanding of what a symptom is. And so patients, they keep saying, I just have the sniffles. It's just a little cold. Oh, I just have a cold, or it's sinuses. And that has been one of the biggest problems with what's going on right now, is because this lack of recognition that those are actually symptoms. And so we actually had to stop seeing patients in the office again, because every day I had people coming in for their blood pressure who we go through our COVID screenings, and they would answer no to all the COVID screening questions. But then as I'm actually talking to them, they would have the, oh yeah, oh, by the way, I have the sniffles. Or I see them sniffling in the office, or they cough. And I say, well, what's going on? And I'd say, well, go get tested. And they were all coming back positive. I mean, all of them. And so, and then my whole entire front staff ended up getting sick. And so, you know, that ended up, of course, detrimentally affecting how we could care for other people who were well. So to keep everybody safe, we had to go back to just a full virtual clinic, and we're going to try again next week to kind of reopen the doors. But the biggest thing is that misunderstanding of what symptoms are. And so I want people to, if they're listening, to understand that if you have sniffles and you think you have the cold, then that is a reason to potentially go get tested. And because it's not just, oh, well, I don't feel that bad, it's the person next to you who you are spreading it to. And that, unfortunately, I have had, because I take care of families, I've seen deaths of the grandmother, deaths of the aunt, deaths of the cousins, because people just thought they had the sniffles. And because they are unvaccinated, because the information that is out there is not consistent with what the truth is and what science tells us, then they're not getting vaccinated. So I'm imploring people to not wait until it's too late, because I have a lot of criers now who are like, I wish I had, and that's what we want to avoid. So if you can do what you can do now, go ahead and get vaccinated now, so that we're not having the I wish I had done it conversation for you or any of your loved ones.
Well, it would seem to me that the way things are going right now, that deaths are needless and unnecessary if people would just get vaccinated. Thank you for sharing that. I can only imagine how frustrating it is for you as a healer to know that there's so much that's avoidable, and certainly it is unnecessary, and to see that kind of suffering going on. And I appreciate that. This young person on his journey, Tom Diamond, Tom just started his medical career. And Tom, you've commented a lot on social media about COVID and what's going on in the community. From these young eyes, and believe me, that sounds condescending. When you get to be our age, you'll wish you were young. We all do. Tell us what you see. Fresh out of school, what are you seeing?
Thank you. Can everybody hear me?
Mm-hmm.
Okay. So one of the issues that we are facing, and being, wow, what a time I chose to come into medicine, in the middle of a pandemic. It's literally, I flipped over, I'm taking USMLE step 1, and then the next moment, the epidemiology portion, everything is living out in front of my face. So interesting time for me. I've had to explain what mRNA was more times than I think a lot of people have ever wanted to. But one of the things that we see coming into it and being part of this social media age is misinformation spreads so much faster than I think the time before us. And as a medical community, we're struggling with getting out proper information before misinformation can spread, right? And it literally takes just a small snippet of something, and it goes viral, and you have a million retweets or whatever, and people all across the country are now saying, "Oh, well, this is this," you know. And so, where the layman doesn't understand what peer review articles are, the layperson doesn't understand what evidence-based medicine is, or science, or even the FDA approval process. You know, we watching people debate in social media, "Oh, it's not FDA approved." And they don't even understand what the FDA approval process is, right? And so, as a community, we're not only having to face the effects of COVID in the physical form, but also we're facing the misinformation on social media. We get our information so fast, right in our hands and our phone, and it's almost hard for people who know the science, who know the correct information that can help patients, to combat what's happening in social media in real time and actually happening in the real world. And so that's one of the things that I've just been kind of taking personally, coming right out, and I'm jumping directly into my rotations. And even my rotations have been affected, you know, I'm at Jackson Memorial in Miami. You know, it's COVID, whatever you're doing. If it's pediatrics, it's COVID pediatrics. If it's psychiatry, it's COVID psychiatry. If it's family medicine, it's COVID. You know? And so, unfortunately, I'm getting COVID everything. But from my colleagues and my friends, you know, I have to continuously, and I try to make about 3 times a week, where I post something on Twitter, on Facebook, just dispelling myths, right? Just dispelling, you know, what are the effects of a vaccine, right? And people, I'm not getting the vaccine. And it's like, they're about to mandate the vaccine. And I'm like, well, if you went to public high school, you already had that vaccine mandates. It's called our shot records. You know, and people, you know, beginning of the pandemic, the vaccine was rushed. And I was like, well, do you know how long it takes to make a vaccine? You know, and so you have to piecemeal and be very patient at all of our levels, but the level I'm on, because I can't get on social media, and especially with my white coat pictures, and just so proud of everything that I've been doing. And I get bombarded with questions and bombarded with just false rhetoric that just isn't true. And unfortunately, it's moving a lot faster than we can put out accurate information, and it's causing harm to our patients. It's causing harm to our community, and that's what we're fighting. So.
Wow, Tom, that's amazing. That is absolutely amazing. Before I move on to someone else, I got another quick question for you, if you don't mind. Your generation, your age group, because you're what, early 20s, I mean mid-20s right now?
I just turned 30 last month.
Oh my goodness. Boy, I'm getting old. Lord, I'm getting old.
I turned 30 last month.
Look like you're losing your hair already. Is that what the cardiology?
Yeah, that's what it's doing.
Again, I brought you on for a dualistic reason. I really, because I've come to love these guys. Pardon, ladies, me, Conway guys. I've come to love these folks that I've been able to meet, and I just wanted to, you know, kind of shock them back into reality, what they used to have to go through. So you're serving a dual purpose tonight. But seriously, your generation, or those in their early 20s, the numbers aren't good.
No.
Is there a consistent message that has to be broken through? Is there something you hear consistently that most are saying this one thing kind of prohibits them? Because persons who are watching tonight, they have children, grandchildren, they've got friends, relatives, and they may have to deal with the same things you're hearing. What is that one thing you're hearing from young African Americans as to why I just don't want to do it? What are you hearing? I'm curious.
It's 2 parts. The
Okay.
main thing is, unfortunately, an arrogance of feeling that I'm invincible.
Mm-hmm.
Right? It's not me. It's them. It's not me. It's that person. It's her. It's him. Right? And the second issue, and I don't know how we can combat this, this is something that we can all think about and probably come back a little later, is my generation received its education through entertainment. We look at the movies that we watch, I Am Legend. We look at the, you know, the every 4 years there's an apocalypse movie and the end of the world. And there's this vaccine that's released and people become zombies, The Walking Dead. And there's this, you know, we have to save, and there's a little bit of tribe of people left to repopulate. That was the entertainment. Hollywood really messed up the psyche of my generation. And so now everybody in a white coat, everybody who has doctor in front of their name has now been aligned with the government, and this is a plan to microchip. And I tell people all the time, listen, you hold the microchip in your phone every day, in your hand every day. We carry these on us more than we carry anything else, right? This is how, if they want to track you, this is how they'll do it. But our generation has been educated through entertainment. And so you have to walk back. Not only do you have to teach science to what would be lay people, you have to now combat Hollywood, right? And that, listen, this isn't the first time that a vaccine is rolled out. If you're 65, 70 years old, you remember the polio vaccine and how it almost it did eradicate polio until now we're starting to see cases again. But my generation is clueless to that. They feel like this is the first time we've invented the wheel. We're trying something new here. And, you know, we just found out what coronavirus was last year. And now we're in here experimenting on people, and it's about to become The Walking Dead. And you can't convince anybody else of that, because every night they watch Netflix, they watch YouTube, they watch their favorite entertainment, and that's what Hollywood has been feeding them. And so when we come and say, hey, this is something that's going to save lives, no, because I saw that on episode 25 of such and such. And, and you know, people, I don't know what the long-term effects of vaccines are. And if we look at the history of vaccines, I tell people, listen, there are no long-term effects. Let's look at the history of them, right? Of every vaccine that's been administered in America. Where is that? Where have we moved astray and become this zombie that you're thinking about? And so we are fighting Hollywood. You're fighting Netflix. You're fighting Hulu. You're fighting all these streaming services as you're talking to your patients. And I want you to understand that, because although you're saying something, they're getting a different message on TV, and it's like, oh no, this is how the show first started. They all took a vaccine, and then we became zombies. And so that's it.
Well, man, I appreciate that. That's amazing. And for those of you just tuning in, you're watching a presentation tonight from some of our best and brightest physicians, doctors fighting COVID here in Jacksonville, Florida. And certainly we're happy to have you. And of course, if you have any questions, you can go and put your question into the chat or raise your hand if need be. Probably the question, I think, is probably for you watching by Facebook, and be able to contribute tonight. I want to, if I could just kind of move a little bit, even though what Tom said was very gripping in terms of how he put it in terms of the Hulu, Netflix, and all of that. I'm thinking more about Twitter and, you know, Instagram and all that, but to hear about what you're saying is just so that media is so powerful. But what I wanted to kind of move towards is still looking at it through your eyes. We have some persons tonight here who are hospitalists who've dedicated their lives to dealing with patients in hospitals and their sicknesses and disease. And from emergency medicine into hospitalists, could you kind of share with us what you've seen in your own experience, and just give us the raw deal? What's going on? Dr. Cowart, I'll go to you.
All right, I'd be happy to start. So I'm Dr. Jennifer Cowart. I'm a hospitalist. I basically have the same training as a primary care internal medicine physician, but instead of doing primary care in the clinic, I work in the hospital. And like Dr. Diamond said, I went into this field thinking I would get this great breadth of different things. And for the past year and a half, it's been COVID all the time. everything COVID. And so I have been working and taking care of COVID patients for the past year and a half at my hospital. And that has cycled up and down as we've had various surges. Since the beginning of July, this has been the biggest and worst surge that we've had since this pandemic started here in Jacksonville specifically. The most patients, the sickest patients coming to the hospital. And so looking at our case numbers, first off, I do want to say that it looks like they're starting to come down just a little bit. I think that's a cause for celebration. It is not a cause to think that we are out of the woods. We are still admitting new patients to the hospital every day with COVID. The patients that are coming in are very sick. Many of them stay in the hospital for weeks. I was just on the service over the weekend, and I had a young person in their 40s, had previously healthy, not a single medical condition, no comorbidities, nothing, no bad habits. And that person has been in the hospital for 1 month and continues to be in the hospital. So they are still needing oxygen. They are getting better overall. I want to make it clear. They are not on a ventilator. They are getting better, but it is slow and it is agonizing. This person did not see family members in person for 4 weeks until they were finally off of the high flow oxygen and cleared from isolation and could finally have a family member come face to face. They cried when I said that they could have a family member visit. I cried because the sheer suffering, the physical suffering and the emotional suffering of this person and their family, and not knowing when yet they'll be well enough to go home, because you have to be on a low enough amount of oxygen to go home. And so these are the conversations that I'm having every day. I have the ramping up conversation, someone looking at me and crying and saying, Doc, am I going to die? And me saying, we are going to do our very best not to let that happen. And you'll notice that what I didn't say is no. We're going to do our very, very best. And most of the time, people do not die. I want to make that clear, but many get very, very sick, and I cannot predict who that's going to happen to. So I have the ramp up conversations with people crying and scared. And then I have the ramping down conversations and trying to predict, when can someone go home? Well, you've been in the hospital for a week away from your family, and trying to figure out when they can go home. The last thing I want to say is to echo also something that Dr. Diamond said. So I tend to just lightheartedly advise to patients, tell your friends, COVID sucks. Sorry, Pastor. COVID sucks, and get the vaccine and wear a mask. This is my lighthearted advice to patients. And many of them will say things like, I just didn't think this could happen to me. I thought I was healthy. One person told me they didn't fear COVID. And then now suffering in the hospital, they do. And so I always tell them, I don't want you to live in fear. That's not my goal. My goal is for you to protect yourself, to take this vaccine and this scientific guidance that I believe God has helped us to have, and to take those things to keep yourself and your family healthy. So I hear also the same things that Dr. Diamond has heard, patients that just didn't think this could happen to them. They think, I'm going to be the one that just has the sniffles. This is no big deal. It's all overblown. I'm healthy. And unfortunately, when they're the ones that are suffering in the hospital, then they have nothing but time to think about it. And I hear a lot of regret, just like Dr. Johnson Foy said, a lot of regret, a lot of why didn't I? So we're here really to just continue to pass that on, that's what patients tell us, that they regret not getting vaccinated when they come to the hospital and they're sick and they're suffering. And that's what all of us went into medicine to try to prevent, is sickness and suffering. So that's really, I think, where I would like to close out tonight. Thank you, Pastor.
Thank you. Thank you very much. I can only imagine the emotional toll that it takes to avoid answering that question, am I going to die? You can begin to express what that would feel like to have someone, well, I have been asked that as a pastor sometimes, and people gotten themselves into pretty bad situations in emergency. It's a tough thing to deal with, but you're dealing with it frequently. And so the emotional toll can even be estimated. Anyone else from the hospitalist space like to chime in on what Dr. Coward said?
For sure, if it's okay, I can chime in. I wear dual hats. My name is Dr. Mohammed Reza. I'm an infectious disease specialist by training, and I work in the outpatient basis. I'm the medical director for a couple of clinics through CAN Community Health in Daytona and Jacksonville. That's my weekday role. During the weekends, I work as a hospitalist at Mayo Clinic. So I work with Dr. Cowart at Mayo Clinic. That's my side gig. And I love doing both of them because it keeps me sharp in both fields, is what I feel. And I've worked as a hospitalist now for almost 10 years, 9 to 10 years. And this last 6 months has been unlike anything we've seen as hospitalists. Dr. Cowart will tell you the same thing. Nonstop, one after another. And it's all COVID. I joked with one of our ICU colleagues this weekend when I worked, and they were downgrading a patient from the ICU to make more room to have other patients in the ICU. And he's telling me, hey, I have a non-COVID patient for you. And we both kind of laughed and said, what do we do? Because what we've done is COVID for the last 8-9 months. We were joking, completely joking, but you got to have some humor in what we're seeing. And just like, Dr. Coward's saying, we see this over and over, and patients are coming in. And I ask every one of the patients I have now admitted over the past 18 months, at the end of it all, is there a reason why you didn't get vaccinated? The responses are the same over and over. I didn't think I needed it. It just was rushed. I didn't get around to it. But in the meantime, when they're sick, they're taking ivermectin. They're taking hydroxychloroquine. They're taking all these experimental things that we know some of them don't work, but they're taking those things. So it's just so important that we get this message across. These vaccines are godsend. This will help us get out of this pandemic, but we need to do it as a whole, as a community, as a whole world, for us to get out of this together. Masks will work no matter what variant you're coming in contact with. It's so important, and we say this over and over. If you wear a well-fitted mask, the entire world wears a well-fitted mask for the next 6 to 8 weeks, we're done with this pandemic. We keep that distance, we wear a mask, we are done with this pandemic, but we need to do that and understand that what happens in another part of the world is going to affect us. What happens in this country is going to affect that part of the world. The Delta variant came from India. We have now variants that are popping up in the US because of how much virus that's being spread. And people ask me, why are we getting all these variants? Because of us. The virus can't make copies of itself anywhere else. It happens in humans. Virus is not smart, it makes mistakes. And some of those mistakes make it more successful to be able to infect other people. And over time, viruses are dumb. They're going to keep making mistakes. Over time, they'll get it right, 1 in a million. And our vaccines may not be as effective either. So we are all in this together, and we have to see that as a country, as a community, as a world, we're all in together, because that's how we can move on from this infection. So I have a dual perspective as an infectious disease doctor, and I've lost patients on the outpatient world as well, and they're fully vaccinated. So this idea that once you're vaccinated, you're free to do whatever you want to do is just not true. We're seeing that more and more. That's why having that layered mask along with getting vaccinated and trying to keep some social distance is what we need to do as we go forward. But the pain and suffering that I see, and it's one after another, because patients I admitted this was last week and the weekend before, the wife didn't get vaccinated. Both the children got mildly sick. They were too young to get vaccinated. The husband's fully vaccinated, no symptoms at all. The wife can't breathe now. She can't breathe. And I don't know if she's going to survive because her saturations are in the 50s when she walks in. Normal oxygen saturations 90 or above, 88 or above. So that's what we're dealing with over and over. The heartbreak that we're seeing across this country just play out. We see it every time we walk into that hospital, and it's families that are getting infected together. So you see whole families. This variant is so much more contagious. It's a different virus to an extent. Somebody called it COVID-21. That's really what it is. This is so much more infectious, 225% more. That's why we're seeing children get infected with this variant with long-term effects, COVID long haulers in children, up to 10% of children plus. So that's where we see it. It's heartbreaking, but at the same time frustrating, because this is all not preventable, because we have fantastic vaccines and masks work. So thank you.
Thank you very much, Mohammed. I appreciate that. That's gripping. It just is. I have no better word for it than that. I want to go to the chat before we get to some other doctors. In fact, we may be able to kind of kill two birds with one stone here, simply because I've got a question from one of the members of our church, Sandy Lightfoot, and here's the question. If a child has allergies and is always sniffling and has been vaccinated, does that child still need to be tested? And I know we have an allergist here on board, so I'm going to turn it over to the allergist.
Thank you, Pastor.
Sunil.
Yes, thank you so much. So yeah, absolutely. So that's a great question, and believe it or not, we see that multiple times a day in our office. And so people who are having sniffles, cough, congestion, it's so easy to blame it on allergies, and typically that's an easy out, and we certainly would go down that path most of the time. But right now, even if you are vaccinated, even if your child is vaccinated, I would 100% recommend that they get tested, because these children are in school typically. They are not only, risking spreading the infection to their own family members, they're risking spreading the infection to other people in the community, in particular their classmates in schools, where at least right now, at least for the next few days in Duval County, we do not have a mask mandate until September 7th. And so that risk is there. And so yes, even though your child may be vaccinated and is having symptoms of sniffles and sneezing, I typically would still ask for them to be tested even before we would start to talk about how we're managing them in the office. So I do think that's a good question. I am going to address a couple other things, if you don't mind, Pastor John. So just so you know, I am an allergist and an immunologist, and I am board certified in immunology. And for all these years practicing, for 16 years, I didn't get to use immunology. And so if there's one person that's happy about vaccines and viruses, it's like the immunologist. We get to talk about things that we get really excited about. And so it is, as Dr. Reza was saying, I think a lot of the concern about getting the vaccine and about having reactions to the vaccine is also what's limiting people from getting it. In January, about 40% of the adult population who said they will not get vaccinated, 40%. That has come down to 20% now. Okay, so it's been cut by 50%, where we've gotten to the point where we are getting the word out. And the question is, how do we do that? And you do that by educating people about the safety and effectiveness of the vaccine. And I do think early on, people were concerned when you only had 30,000 people in the study and you had emergency use authorization for the vaccine. We now have given 350 million doses of the vaccine here in the United States. 167 million people are fully vaccinated. The blips for side effects and significant long-term effects from the vaccines are nil to non-existent, but not getting the vaccine is putting you at significant risk for hospitalization. As we're seeing, 90 to 98% of our hospitalizations are in the unvaccinated. And as Dr. Reza said, it's also the unvaccinated where these variants are spreading. And so we start to look at this as a way that, hey, we all want to be able to go see the Jaguars play on Sundays, right? We all want to go to see a movie. We all want to go to a concert. If we look at this as a way to do things together as a community to get that last 40% vaccinated, we will get rid of this virus once and for all. It's just a matter of understanding the safety and the effectiveness of the vaccine and how dangerous the virus can be too. I'll tell a personal story from our office. We call ourselves a work family in our office. We've lost 2 members of our work family in the last month to this virus, okay? It's been incredibly difficult for all of us. So not only is it emotionally difficult for us, it also makes us short-staffed. It makes it so that our patients have to wait longer to be seen. And it's this incredible trickle-down effect on everybody, not just emotionally, but also in how we're able to get work done in the office. And so this does touch close to home. It is not something that's happening in New York City or in India or in other places. It's happening in Jacksonville. We were the epicenter for the virus just 2 weeks ago. 25% positivity rate. That's 1 in every 4 people, folks, that were testing positive. Okay, so when we talk about having masks in schools and we talk about getting vaccinated and doing all of these things, it's because we're trying to mitigate that spread that's putting people in the hospital and making them very, very sick.
Well, you said something that kind of touched me a little bit in terms of, or triggered something that I've been thinking about. And I don't want to, be anti, economics here. But you mentioned the football games now in football season. NFL this year has decided not to have a mask mandate, and they're not sectioning off persons per so many seats. It's whoever can come, they can fit them in, they're going. I hate to ask, but I have to. Are those potentially super spreaders events?
Yeah, I mean, it's scary. Now, I will say, like, for instance, in Louisiana, the New Orleans Saints, who right now, unfortunately, because of the hurricane, can't play at home, but they do have a scenario where they want their attendees to be vaccinated, and if they're not vaccinated and they don't have proof of vaccination, they have to have a mask on. So they've got, at least in some parts of the NFL, you've got some groups that are doing that. We are not doing that in Jacksonville, and so there is some concern. We have 68,000 people sitting in a stadium, and we don't know the vaccination status. And of course, you're very unlikely to see people wearing masks in that scenario. There is some concern about that. It's an outdoor arena, so that helps a little bit. But having that many people together does have me as an immunologist, speaking as an immunologist, has me a little concerned.
Wow. Well, I guess people should be cautious. And by the way, the New Orleans Saints are coming here September 12th for their first home opener, by the way, just to throw that in there. Got another question from the chat from Elaine Cameron. I think this is a very common question, so I'm so glad you guys are here tonight. And here's a question. I have underlying conditions. At what point do I get a booster shot, and does it interfere with my flu shot? Any one of you want to jump in, can feel free to take that.
Pastor Newman, may I?
Yes, ma'am.
So I want to first and foremost, especially speak directly to your congregation, that these vaccines are literally an answer to our prayers. Science provided us a miracle to prevent this illness and this suffering. Do we have treatments for it? We have some. We have more than we did at the beginning of the pandemic. Are they as good as prevention? Never. So we have the opportunity to prevent. And so I think that is first and foremost. And I thank Elaine for her question regarding vaccines and regarding boosters, because there's a lot of questions, since this is kind of a new topic and an up and coming topic. There's also questions about, do you have to space it out from other vaccines? Initially, they were recommending spacing it out at least 2 weeks from other vaccines, but that's no longer the case. So there's no need to delay. The worst thing, what all the doctors on this panel are fearing is this winter having to deal with COVID and influenza at once, or God forbid, not just in multiple patients, but having both in the same patient would be catastrophic. So please, by all means, get your annual flu vaccine, get your COVID vaccine. It is all going to depend on multiple different factors, and I can't give a blanket answer that's going to answer for everybody. It depends on the individual person's, age, their personal risk factors, things that increase your risks like obesity or other conditions like diabetes or hypertension would put you in a higher risk category. It also depends on, are you currently undergoing cancer therapy? Are you in chemo? Even if you were younger, that would put you in a higher risk group. Or do you have an immunodeficiency? That would put you in a higher risk group. So all of those different things need to be taken into consideration, as well as when was your primary vaccine? When did you get your original doses? So I think the best thing to say is I would encourage people to talk to their primary care doctors. Absolutely seek out the booster and see if it's right for you. A lot of doctors now, one of the good things that has come out of this pandemic, I think, has been an increased access to telemedicine and telehealth. And for a lot of seniors or people with mobility issues, it can provide a way that you can get a hold of your physician, provided that you have access to internet and to reliable means of getting to them. But if not, call, or if not, make an appointment to see your doctor to discuss it. A lot of doctors are now starting to have vaccine in their office, or if not, there is, of course, available in the pharmacies, in the hospitals, things like that. But absolutely a fantastic question from Elaine.
Thank you very much. I kind of want to, and I know one time in the past, there was this kind of proclivity to not want to talk so much about what physicians and persons in the medical space are going through. But I kind of want to, remind everyone that doctors and nurses are not robots. They have, excuse me, they have feelings. They have bandwidth. And Scott Silvers is also in emergency medicine. Scott, if you could share, I'll just say it. Can you share the frustration of what you see coming through in emergency medicine, knowing that so much of this is needless, knowing that it's unnecessary, that it doesn't have to be, and also just kind of give us, through your eyes, because you're dealing with on the front lines as Dr. Gale and others. What are you saying, and what kind of toll is it taking? Go ahead, and I'll go from there. Thank you.
Sure. So again, my name is Dr. Scott Silvers, and I'm board certified in emergency medicine, and been practicing emergency medicine for nearly 25 years, first in Boston at Massachusetts General Hospital and the Brigham and Women's Hospital at major level 1 trauma centers, and here at Mayo Clinic for the last 20 years. The vast majority of my time during this pandemic has shifted to helping staff our COVID clinic. But I'll tell you this, that there is people, you hear people talk about, Pastor, the disconnect that we feel exists. Those of us that work in medicine, we feel like there's this incredible disconnect between what we know, what we see, and what we hear, and what people think, lay people out in the community. I have never seen a virus do this much damage, cause this much suffering, seen so much anxiety on even normally healthy people's faces. And then out in the community, you step outside of work and you're walking, picking up groceries, being careful, wearing a mask, and you see people being really cavalier, not wearing a mask, almost like it's a badge of honor to not wear a mask. And you hear people saying, "Oh, come on, doc, is it really that bad? I mean, it's like the COVID flu." And they like to try to downplay its effect by calling it the COVID flu. Let me just assure everybody that's listening to this, Pastor, this is nothing like the flu. This is nothing like anything I've ever seen. And the amount of suffering and damage that this virus is causing is enormous. And I find it so ironic because for the past, 23 years, people have been calling me and saying, "Hey, can you tell me, I've got this medical dilemma. What do you think? What are your thoughts? What would you do?" And I try to hear everybody out and try to understand the situation and help explain what we know, what the science tells us, and help guide them as to what I would do. Another disconnect, what is so shocking for us in medicine right now, is those people that we love. And Pastor, you talk a lot about love. And we have friends and family in our community that we love, and we've spent careers trying to perfect what we do and stay up to date on the science and leverage all of it for our friends, our family, our community. And we're always trying to help steer people to do the right thing. It is a disconnect. I could have never imagined that we would have people listening to politicians and news feeds or their non-medical professional friends more than us. For the last 23 years, they've been coming to us, and now all of a sudden it seems like, we're not the right resource anymore. Now it's the news, and it's dangerous. It's causing more suffering than is necessary, and that is an incredible disconnect that exists. And it's really shocking for me, especially when I see it in my highly educated professional friends, and to hear them kind of regurgitate this false information that that so many other people are speaking about in the community. Just Pastor, please, all of your congregation, listen to us. There's nothing but love on this call. There's a lot of medical knowledge, and it's such a privilege to be here to be able to share what we know. Please listen to what we're telling you. You've heard about the vaccines and how safe they are. At this point, there are a few vaccines in the history of vaccines that have received this much scrutiny, this much evaluation. And in some respects, I think our current vaccines, there's no really perfectly safe vaccine. There's always a risk of something with the vaccines, however minuscule it is. And honestly, I think this vaccine is probably safer than some of our other vaccines that nobody has questioned over the years. None. Nobody's questioned getting flu, measles, mumps, rubella when we tell them this is the right thing to do. So, you know, the vaccines, it's amazing when you look at people when they can't breathe. And this virus does a lot of things. It's causing neurologic injury, it's causing blood clots, but we all know that one of the primary things it's doing is making it very difficult to breathe. And let me tell you, in psychology studies where they get people to rank the anxiety, what are the most anxious, what are the things that produce the most anxiety for them? Not being able to breathe is number one. And when you see people who can't breathe and their eyes are open and they know they're in trouble and they're in high flow oxygen and they're wondering what's going to be my future. I've got to go to the hospital, and am I going to be put on the ventilator? And that's a really bad place to be. We still have hospitals in town that are having to add oxygen, banks of oxygen tanks to the side of their building because they're running out of oxygen. And they're ordering refrigerated trucks because of the bodies that we're seeing. There's so much death that's happening, and it's going to continue to happen until people take this seriously, trust the doctors who have been spending their whole lives studying and care about them and love them and want to see them and the community be healthy, get vaccinated, distance, wear a mask. We can turn this around. This is, like Dr. Reza said, this is a preventable illness. So that's really the biggest disconnect. I hope I articulated it well, but that's some of the most, every morning I wake up, I tell my wife, I feel like I'm in an alternative universe sometimes, that for the last decades, people have asked me what I think, and now somehow they know more than I do, and they're not even in medicine.
Wow, Scott, thanks a lot. And what you said is so powerful. And I can only imagine, and you didn't really say this, but I can only imagine at some point, it's probably for most of you, you get angry when you see the needless suffering. You know, it makes you angry. And I'm sure so I don't know whether you have scream therapy, you find something to just go and yell at, in your frustration, because I can see that it's tremendous from what all of you are saying. And I wanted to just remind people that you're watching the Delta variant in the Black community at Town Hall tonight. And we're so thankful for COVID, doctors fighting COVID, and the great work that they're all doing. And I want to also thank my own congregation for sending in questions. And I'll see questions that are in the chat. And I want to thank those of you who are doing double duty tonight, who are not only appearing on screen, but you're also going and answering questions in the chat. I've seen some of you do that, and so I really do appreciate that. And thank you for that. Dr. Anil Suryaprasad, I hope I didn't butcher your name. I did pretty good? Okay. Can you please chime in on everything you've heard so far, and if there are any gaps to fill them in for us, or just kind of share what you're seeing through your eyes? Really what I want to hear from you.
Yeah, absolutely. I'm Dr. Anil Suryaprasad. I am an outpatient provider in a clinic that takes care of HIV and viral hepatitis patients. I work with Dr. Reza right now. In my past, I worked with Dr. Cowart, Dr. Silvers at the Mayo Clinic as well as a hospitalist. And in my more distant past, I used to work as an epidemiologist at the CDC. And so I've seen a public health pandemic unfold. Unfortunately, now for the second time, I had participated in response efforts with the 2009 pandemic with H1N1, a very different scenario, a much more benign scenario. But when that began, a lot of the same fears were there that have unfortunately come to fruition with this pandemic. And I think when you look at a pandemic and how it unfolds in a society, you see an emergency of public health, obviously, and of critical illness. You also see missteps in communication and how we are able to relate to the public, and that those missteps can happen at every level. And so much of what is preached at the CDC is about, managing the chaos and managing the communication in a situation where there is such mass chaos. And I think there are people at the CDC would probably say that there have been some missteps in that process. But what has become clear to me, unfortunately, is that in the midst of the last 5 to 10 years, and probably dating back before that, there's become more of a popularity of having an anti-establishment point of view, having a point of view that don't trust those that are put out there to be trusted, because the government is out to get you. The doctors really don't care about you. It's all about the pharmaceutical industry. It's all about ways in which they'll take advantage of you. And sadly, there have been times where situations have occurred where folks have been taken advantage of. The topic of Tuskegee was brought up in the chat, and Tuskegee is one of the sorest topics, I think, that has affected the African-American community, and is one of the most important things that's happened, I think, in public health, and something that a lot of people who've worked in public health, feel a sense of shame that was sort of a stain on our history. And for those of you that don't know about Tuskegee, it was some studies that were done looking at the natural, and I say studies in the loosest terms. These were unethical natural history experiments done on African Americans for decades, looking at the natural progression of syphilis in African Americans at a time when treatments were available and at a time when these were completely treatable illnesses that could be cured. And it was a shame that occurred. It has engendered, along with other difficult experiences of African Americans with the healthcare system, it's engendered a lot of mistrust, unfortunately. And in trying to fight some of that mistrust, I think sometimes we don't always see where people are coming from with their points of view and why they have that skepticism. Tuskegee is one perspective that is out there of the type of situation that could have harmed folks of color that they may fear, but I don't think that that's everything. And I think I had this conversation by text with the pastor on WhatsApp at one point in time, that it goes deeper than just the mistrust associated with some of these injustices in the past. And it starts getting into some of the topics that I think Dr. Diamond had been pointing to, some of the, the issues with conspiracies that have kind of come out through social media, through the entertainment industry, through how we've come to think that somebody is out to sort of get us and the government is out to set us up with a microchip, whatever these different scenarios might be. But I think sometimes we have to step back and put these in perspective, and the facts are the facts. When we say 630,000 people have died in the United States, it's laughable to me that there were politicians at one point in time saying these are people not dying of COVID, that they were dying with COVID. These are the most nonsensical arguments that I've heard, and unfortunately have gained traction in the community. I've heard people make that argument to me that, come on, are people really dying from this illness? You've heard firsthand from a group of physicians here who are on the front lines taking care of these patients that yes, patients are dying of blood clots, heart attacks, strokes, respiratory failure, kidney failure, liver disease, GI illnesses, and all of this is due to COVID. And it is an illness that has been a scourge on our society the last year and a half. And unfortunately, I think we could do a better job as a society trying to gain the trust of folks again and trying to have people believe in the medical expert opinion and believe in the science that's out there, because that science is based in rigorous studies that have been conducted in numbers that we've never seen in history, in terms of people who've been evaluated for vaccine effectiveness and safety. And I'll say that one more time, we've never seen numbers like this with any vaccine in history. And, you know, I've seen many, a scientist who's been involved in smallpox and polio speak about this very issue. And if we had handled polio or smallpox in the way that we are handling our approach to the vaccine as a society now, we might not have ever eradicated those illnesses. And they were illnesses that were also killing people, you know, and we have our predecessors in history and our ancestors to thank for, you know, putting their arms out and taking that vaccine and really trying to get rid of illnesses that were killing lots of people. And now we're all in this situation where we can step up to the plate and do the same thing. And when we say that we're all in this together, we literally are in this together. There, you know, if we were all able to wear a mask and get a vaccine, these variants would stop forming. This virus would stop spreading, and we could actually put an end to this madness. And it really, you know, I guess it takes a village for all of this to work, you know, and I think the struggle that we're having is, how do we have everybody buy into the same logic because of all that mistrust that's been out there?
Sure.
And I would be open to all of your opinions on, you know, how do we gain that trust from people? Because that seems to be the term that I hear so often from patients that I see in the outpatient setting is, I just don't trust the government. And by default, I don't trust the doctors. I don't trust the pharmaceutical industry. I don't, you know, and it's a shame to me, because there are things that have happened like Tuskegee that are reasons not to trust, right? But we are in a different era now, and there are rigorous ethical standards for research. There have been African Americans as part of every randomized control trial that has been in play for these vaccines. And there is real world data from post-vaccine surveillance of adverse events that is reported to the CDC that has involved every race and ethnicity in the world. And we've seen that these vaccines have a pretty remarkable safety profile. And the few serious safety incidents that have occurred have been incidents that when you look at how often they've occurred in people vaccinated and compared to how often those same types of illnesses occur in people with COVID, they're happening much more commonly in people with COVID. Take blood clots, you know, and so I'll leave it there and just kind of, you know, say trust, I think, is the big issue for me,
Sure.
and how to gain that trust.
Sure. Thank you, Dr. Prasad. I appreciate that. And it is tragic that people get into a mind space where they distrust institutions and institution of government. And certainly there is a history there. But at the same time, you know, we can see very easily, if people wish to, that that's not the case right now. Certainly it's not the case. I also want to kind of touch on something I think is important as we try to dispel myths tonight that are running rampant in the African-American community, because that's really, you know, the focus tonight on what's happening in the African-American community. And one of those things that's happening is there are mothers, I'm going to go to you, Dr. Johnson, for, and also Dr. Cantwell as well. There are mothers who are wondering, this came from the chat tonight, how do I deal with pregnancy and vaccines? Because there's some myth out there as to don't get the vaccine because it's going to affect your baby, or don't get the vaccine or you won't be able to conceive. And so, for African-American mothers, of course, who unfortunately, statistically, lose their lives more than any other group of persons who are giving birth. Speak to that if you don't mind. I know we only got like 15 minutes, but we have to roll. But we definitely want to address that to kind of dispel what's out there in the community. So Dr. Johnson-Forth and Dr. Cantwell, I thought I saw that Ryan had his hand up. I thought I did. I did? Okay. All right, then I'll come to you, Ryan. Thank you. Dr. Johnson-Forth.
Oh, no problem. Thank you. So when it comes to, well, there are a couple of things that I wanted to say and answering that question. So as we talk about things like Tuskegee, which are extremely important, one of the things that kind of I've lived my life doing is trying to really go beyond the negative point and figure out what happened next. And I think a part of building trust and what I try to remind people of is that there's a reason that they know about Tuskegee now. There's a reason that this is something that can be talked about now. Is because there are things that came out of it that allows you as the public to know, hey, these things went down, which were completely unacceptable, and we can't let them happen again. So because those things happen, now we have some things that we have tried to put in place that are going to be these safeguards against letting people run amok and do whatever they want to do and practice and experiment on people in a way that is completely abhorrent. And so I don't stop with the conversation about, you're right, Tuskegee happened, and so that gives you a reason and an excuse to not move forward. No. Tuskegee happened, but here is what is happening now. You know about this because someone told you about it, because they know about it, because now there are stop gates, there's IRB review, there's lots of things that are now in place that is meant to make sure that never happens again. So not only are you outraged as a person who is in this community, as doctors, as scientists, we were all outraged too. That wasn't the medical community that did that. That was some people who were just the devil. that is who did that. That wasn't the whole scientific community. So that's not something that we stand for. So it made us know that we have to pay closer attention. It made us know that we can't just accept. So we question things the same way you do, because we know that we are stewards for you. We are vessels for you. We are here to make sure that what we present you with, what we tell you, what we say, yes, listen to us, trust us, is valid. So we don't just allow ourselves to be fed information and then say, oh, well, yeah, here, let's pass this on. We look at what is real, what is valid. We spend weeks sitting around with each other, going through papers and saying, okay, well, this is the reason why we should trust this. This is the reason why. And we argue with each other about whether or not we should take information for what it is. So know that we are on your side. We are expected to get the same vaccines that you are. And so you to us are our family. We want to protect this community. That's the oath we took. That is what is innately a part of us. So that is what you're going to get from us. So we're not a part of some big establishment that gains anything from any backwoods taking the world down. We want to protect this community. And that's what you'll see. So because of that, and as we move forward, I had to kind of stand on that soapbox for just a second to tell people to don't stop at the negative. Keep moving forward and remember what the solutions were to those bad things that happened. When it comes to pregnancy, it is now being shown, and it took a minute to kind of really tease these out because you can't just experiment on pregnant women. You really want to make sure that before you make a recommendation about allowing something to be done in pregnant women, that you feel comfortable with it. And so as of last month, the CDC did release a recommendation that it is safe and recommended that women who are planning to get pregnant and who are pregnant should be vaccinated, and that the vaccines have shown to be safe in those women. The way we kind of came to that is that during those first 8-9 months, you had women who ended up getting the vaccine and then were found to be pregnant later. So you were able to kind of look and see if there were any adverse effects or adverse problems in them, and there wasn't anything shown that was untoward. So now the CDC does recommend that if you're 12 and older, if you're planning to get pregnant, if you're breastfeeding, that it is safe to go ahead and proceed with vaccines. A part of that question I know people ask is there was a bit of misunderstanding of what happens with the mRNA vaccines and the spike protein and whether they can affect fertility. So I've tried to answer these questions several times. It does not have any long-term effect on fertility and your ability to get pregnant. The spike protein that is stimulated when you get that shot in your arm, it self-destructs. So it disappears. And it just tells the body, hey, here is something, go ahead and make these antibodies to it. But it's not the type of protein that actually gets integrated into your part of your DNA that is a long-term problem. So, so because of that, you're able to definitely go ahead and get vaccinated. I have, while being pregnant, I have been vaccinated for other things, not necessarily COVID, but for other things. And so if you don't get pregnant, just like I think it was Dr. Gale or Dr. Cantville who said, like, I know at our hospital, we had a 2-week-old who is not doing well at all right now because of COVID. And so we really want to make sure that we're protecting everybody, protecting the mothers, protecting the children, protecting everyone.
Thank you so much. Dr. Adriana, if you don't mind very quickly, because your husband has been had his hand up, and I don't want to get in trouble with Ryan. So Ryan, if you could ask your question or make your comment, and then I'll go to your bride.
Yes. So I wanted to piggyback on a couple things she said. We in our office had given the vaccine to women pregnant. I actually gave one to a mother to be yesterday. We have given to breastfeeding women and their babies. There was a mother today, actually, the kid was over a year old. She's been breastfeeding, she's been vaccinated. She got antibodies tested on the baby. We don't know what that, the numbers of antibodies mean. A lot of people want to know, well, should I get tested antibodies? It doesn't necessarily, the number, we don't know what that means yet. But the baby had some and had not been sick. So that's reassuring too. Another reason to get vaccinated and to show it's safe. And the thing I wanted to say is, please go to your doctor. I think one thing that in the last year and then going forward, when we've seen a lot of checkups on kids who have missed because parents are like, well, I don't want to come to your office. There's COVID there. I don't want to go to the ER. There's COVID there. Every office, your primary, whether you're looking about for your children or you're for yourself, please go see your doctor. You entrusted her, you entrusted him with your children, you entrusted her or him with your health. Nothing changes now. We still have nothing but your child's or your best interest in every single thing that we do. So please go talk to them about the vaccine. Over a 90+%, upper 90 percentile, darn near 100% of physicians have been fully vaccinated. So that should tell you something right there. We're not only preaching it, but we're also getting vaccinated.
Ryan, thank you very much. And Dr. Canfield again.
So, something that I really want to share that weighs really heavily on my heart. I do some of my hospital medicine covering the newborn nursery. And of course, I attend deliveries. And so as part of that, I get to be, I get to share in a tremendous joy and blessing as families grow. But I also sometimes have to bear witness to the most tragic of pain, of the loss of a mother or a sick mother or a mother that never gets to hold her baby. And what we're seeing with COVID in pregnant women is nothing short of a horror story. A lot of a mother's instinct, always the first instinct is to protect her baby. And so I know that there's a lot of concern about getting the vaccine in pregnancy. And I think that Dr. Johnson was able to address all of those very, very well. I think that we do need to address the fact, and one of the reasons that we're here tonight is specifically to address the Black community. And the Black community is suffering from COVID, is dying at rates much higher than the rest of the population. And so we really need to address those needs. That's what we were our call to action here tonight was specifically with that, that on our minds. And another place where the Black community is very vulnerable is in the maternal fetal space. Black moms die and have complications of pregnancy at much higher rates, and Black babies die at higher rates. So we need to, number one, first and foremost, know that, understand it, understand our own biases in caring for these patients, these moms and these babies that lead to these outcomes. If we don't, we're never going to make it better. And of course, that is what we want to do. We want to change that. One of the ways in particular with COVID that we can change that is by getting moms vaccinated. Pregnancy itself, being pregnant, puts a mother at higher risk for complications, 25 times more likely to die from COVID in pregnancy. So that's not acceptable. And I understand a mom's concern for her baby and wanting, the fear of the unknown. This is too new. I don't want to take a chance. I don't want to take a chance with my baby. And what we need to do is we need to switch our mindset. We're not taking a chance on our baby. We are taking a chance for our baby. This is the absolute best way that we can protect them. That precious life is going to be more safe if the mom is more safe. If mom is healthy, baby is healthy. If mom doesn't get sick and get pneumonia and end up on a respirator, baby is growing better, baby is thriving, baby is much more likely to make it to term and to do well. And so that's what we want to see. We want to see healthy pregnancies. We want to see healthy babies. We want to be in a delivery room crying tears of joy, not tears of loss. It is also an opportunity to pass some immunity to the baby and protect the baby, because obviously the baby won't benefit from vaccination for a while. So this is the best chance we have at protecting not just mom, but also protecting baby. I also really want to address kind of and do a little myth busting as to where this came from. The spike protein is kind of similar in appearance to a protein that's made from the placenta. And so it was theorized that if you created antibodies to one, you'd create antibodies to the other. And that's why it would impact your fertility or lead to increased risk of miscarriage or increased risk of abnormalities or congenital malformations with the pregnancy. All of that has been completely dispelled. Completely. There's not a shred of truth to any of that. And so I really want to encourage moms to empower themselves with the truth so that they can make the best decisions for themselves and for their babies. And not just for their current pregnancy, but also in other future pregnancies. This is really the best way to keep everyone safe.
Pastor Newman, there was a lot of questions about what people are seeing in the pediatric population at this point. Maybe Dr. Gale, or you could kind of comment on that, if that would be possible. Several questions.
Well, in terms of what we're seeing, Dr. Cantville, Ryan, and Dr. Foy addressed those from an outpatient basis. I mean, they're seeing obviously increased number of children with COVID symptoms. I mean, which can be anything from a common cold to being in intensive care that I'm seeing with cardiac failure and importantly, lung failure. In fact, I just had a girl, a teenager, admitted over the weekend in intensive care who has some sort of psychiatric type behavior. We have seen kids with, what we call COVID encephalopathy, where they are confused, they have alteration in level of their consciousness. I had another patient with kidney failure as well. So it can be anywhere from a mild cold and the child will be home to be admitted with respiratory symptoms or cardiac symptoms. So in terms of the Black community, I just want to address that in particular with kids. Interestingly, certainly the sick kids I've seen in the hospital, I would say it's about half and half African-American and half none. But that's still high because, of course, in Jacksonville, we only have about 25% of African-Americans in our society. So we should not be seeing half the kids with COVID. But that just goes to reflect how more common the infection is in the African-American community. From a causation standpoint, there is no scientific evidence to show why if there's a difference in terms of Black folks at higher risk. I think the socioeconomic and living conditions are really why we've probably seen that in many cases, there are multi-generational families in the Black community and more exposure and so on. In terms of exposure, I mean, we know that this Delta variant is a lot more contagious. So I think putting all that together, we're going to see a lot more in folks who live in a more crowded environment versus some genetic abnormality. So, so it is affecting our kids a lot more. And I'm really pleased to just, you know, with people like Adriana, who has helped to get the school board to adopt a sensible mask mandate in the school, which we really need until we can get control of this virus.
Thank you, Dr. Gale, for that. And certainly hats off to the whole cohort of doctors fighting COVID who have put their reputations on the line and maybe to some degree even their jobs fighting for the community. So we thank God for you. I want to also acknowledge, and we're about to wrap up. I mean, can't believe how time has flown here. And by the mere fact that we've had about 100, close to 100 people that have been on this from the very beginning and they haven't gone anywhere, that means that we're reaching the people that need to be reached and they're interested. First Coast News is here, and I'd like to ask the reporter to please come online, and you are now able to speak and we can see you. So if you could please ask your question. Well, I will allow you to come on whenever you get back to the microphone. But until that time, let me just do this. This is, oh, wait a minute, Dr. Johnson-Ford, do you have a quick question? We're going to do a lightning round real quick because we gotta wrap up.
Really quick comment. Dr. Joshi earlier was talking about I think we all kind of
speak up a little bit, you're a little low.
Yes, we alluded to people who have the sniffles and think they have allergies and who are wondering if they should get tested. And so one of the things that has been happening lately is a shortage or a delay in the ability to get tested in our community. And so what I want to say to people is, even if they feel like they are having a challenge and that their symptoms improve, but they're still only about 4 days out since they had symptoms, they should still go get tested because they're still in that infectious stage where if they are going out and about and not quarantining because they never got tested, so they just assume that it really was just some of the sniffles or that they are not really sick, they should still seek out testing to make sure that they don't really have it because they can still spread it in the community. And so I just wanted to make sure I say that. And so look at coj.net for testing opportunities. You have the different pharmacies that have opportunities, but also you can buy some of the products even from over the counter. LabCorp has an opportunity where you can order the test from them. And so we really want people to make sure that they're not spreading the infection. And if you do not get tested, then still make sure you're masking, because remember, that's the biggest way that you help prevent the spread of the infection is by making sure you wear your mask. So just wanted to make sure I said that.
Thank you very much. Again, I want to make sure that any news organizations that are present, we want to acknowledge them. So they have questions, they can certainly ask them. I understand WJXT is on, and if we can bring them on, honey, if I can get a name, or maybe just scroll through the stations, sweetheart, if you could. And if you see WJXT, please bring them on very quickly so we can have their question asked and we can wrap up. What I want to do in the meantime is what we would call a lightning round. And so if you could give us your final thoughts of what you would like to say to the African-American community. And again, we can do this in 30 seconds would be wonderful. If you could share that, what would that be to the community? And let me start with Sunil.
Thank you, Pastor. And again, you know, echoing what everybody said here, very important for us to get vaccinated. Ultimately, that's our way out of this pandemic. The virus does not know race. The virus does not know gender, does not know ethnicity, religion, or any of that stuff. What it does know, what it can do is make us very, very sick. And I think that's what we've been hearing here tonight. So please understand, as Dr. Cantwell said, 96 to 98% of all doctors have been vaccinated in this country. We feel the vaccine and know the vaccine is very safe. 350 million people have also been vaccinated with at least one dose. Also, don't forget to get your flu shot either. That's another big one. Okay, thank you.
All right. I'm just going to go with what my screen is putting in front of me. Dr. Ryan Canfield?
Yeah, just trust your physician. They're always going to have your best interest in mind. If we'd get less science and medicine from social media and more use social media for just fun and entertainment, but trust your physician. We are here for you.
Okay. Dr. Surya Prasad.
I just wanted to reiterate, with the vaccines, vaccines save lives. They prevent hospitalizations and they prevent deaths. You're 25 times less likely to be hospitalized or die from COVID-19 if you are vaccinated than if you are unvaccinated. And I hear frequently from people that, oh, what's the point of getting the vaccine? There are tons of people who are vaccinated that are still getting COVID. There are plenty of people that are vaccinated that are getting COVID, but they're not dying and they're not getting hospitalized anywhere close to the same rates. And so this degree of impact on a public health scale is enormous. These are very, very good vaccines. And on top of it, masks do work. This has been studied. This has been analyzed in reviews of the literature, and masks do help to stem spread of illness from respiratory droplets and when you're aerosolizing your secretions in the air. And they work best when we all wear them. And so that's where, our schools could make a step forward in moving towards universal mask mandate.
Thank you, sir. I see now Axon Jax is also in the panelist section. If the reporter from Action News Jax or First Coast News, if they are here, would like to ask a question, you may do so right now. Well,
Pastor, this is Dr. Silvers. I just wanted to let you know that in the chat, there's First Coast News is wanting to ask a question of Dr. Gale. If he would have anything to say to families who may be concerned about the surge in cases as he's continuing to see a surge in patients running not only through his ICU, but ICUs through the region. And also, if it's possible for Dr. Gale to repeat what he may have said about the young child he said early in the meeting that may have died possibly as a result of the virus.
Great. Thanks, Scott. Dr. Gale?
Yes, thank you. Actually, I typed a response in the chat, but I think the surge in children that we're seeing now is really most likely due to the fact that children are now going back to school and are going around with each other, and in many cases, some are not wearing masks. So I think the presence of the very contagious Delta variant, mask wearing by children above 5 years of age, it is crucial to help prevent the surge in children. So I think that is really what's leading to many of these increased cases in pediatrics. As far as child, we had a small infant who died from complications of COVID in the last few days at my hospital.
Okay, thank you, sir. Let me check very quickly, or maybe one of you guys, did you see the First Coast, was that First Coast News? I think that was First Coast. Action News Jax, if you're available, you can come on. If not, we're going to continue with our lightning round. And we'll also check the chat, see whether there's, and Scott, you did a good job with that. If you can see whether Action News has a question in the chat, I appreciate it. Okay.
WJXT is also on, I think.
WJXT? Okay, I'll get my wife to find them. Melissa, is it?
Yeah.
Okay, anyway, while she's doing that, working her magic, I'm gonna ask Dr. Joshi if you would share your final comments for tonight for this community.
I think I've shared my final comments earlier, but
Okay.
but again, I like vaccinations are our way out of this pandemic for sure, 100%.
WJXT right there. Thank you. And we did find WJXT. All right, perfect. And for all of our news media, if you have a question, you can certainly feel free to come online. You're not a panelist, you can ask it real quickly. And while you're doing that, let me continue to move on. And so Dr. Scott Silvers, could you give us your final thoughts for tonight? You're muted, Scott.
Thank you for the opportunity, Pastor. It's such a privilege to be here with this group of panelists and to be able to help serve in the community and answer these questions. What I would say is this, the original form of the virus on average infected 2 to 3 people. This virus is infecting 6 to 8 people. So, if you think you're gonna get away from this virus during this pandemic without getting vaccinated and without being careful, this virus will find you. It will find you, and there's a good chance that you could suffer from this virus. So please get vaccinated. As you heard, everybody on this call has been vaccinated. I've been vaccinated. My wife's been vaccinated. We can't wait to be able to get our children less than 12 years old vaccinated. I know the Cantvilles, they've shared with us that they're even really helping serve in this effort. Their children are part of the original studies looking at vaccination in children. That's how much they believe in this vaccine and how it's been produced and the impact that it can have. I would like to clarify a little bit about testing. We've heard about PCR testing, which is the more accurate testing, and rapid antigen tests. I just wanted to let people know, I hear so much confusion about this. If it's the rapid antigen test evaluated and results in minutes, that test, if it's positive, is highly likely to be a true positive. So any positive of any test is highly likely to be a true positive. If that rapid test is negative, it can still miss up to a third, 1 in 4 to 1 in 3 patients that still have the illness. So if you're still having symptoms and other people are sick around you and they're COVID and your rapid test is negative, that is likely a false negative. You likely have COVID. The PCR test, the genetic test, is much more accurate. It's much more accurate. You can believe in the positive and the negative a lot more than you can in that rapid antigen test. And finally, don't underestimate the power of masking and distancing in addition to vaccination. This is a preventable illness.
Thank you, sir, for that. Appreciate it. Once again, checking for our news media. If you have questions, please, you can come online, you can come on screen and you can ask it. Dr. Jennifer Cowart, your last comments. Trying to do 30 seconds, but do it do the best you can.
You trying to say I talk too much, Patrick?
No, not at all. No, not at all.
It's true, I do. But I can't add anything to what my esteemed colleague said, other than to say, I'm asking you to do what I do personally and what I ask for my family. So I too am vaccinated. I got my husband vaccinated as soon as we could. My kids are too young yet. I'm eagerly awaiting the day that I can get them vaccinated. They're 8 and 4 right now. And we mask up everywhere we go. So my children are masked when they go to school, even when other kids are not. And this is what I tell them that they need to do to keep themselves and others safe. So, just as a physician, as a mom, as a community member, I am following my own advice. I'm doing my very best to try to stay safe and keep my community safe. And so I just want to say that I'm not asking anything at this point of anyone else that I'm not doing myself. And as a physician, I have these conversations every day about, is the vaccine safe for me? Just like I have conversations about blood thinners and cholesterol medicine. And we take every one of these questions seriously. We look at the literature and we answer it honestly. So please, if you have specific questions to your medical background and situation, like the doctors Cantvill said, please ask your doctor. We want to take those questions and answer them for you and individualize that answer. So thank you so much.
Thank you. Thank you. The Doctors Canfield, that sounds like a mini series, doesn't it? Glad to have you guys. Really, really is. Dr. Johnson, for your last thoughts for tonight to the community, what would you like to say?
So again, thank you for having me here and to be able to share. I think one of the biggest things that I would tell people, I didn't get to say to parents, the question I get is, what should I do about my children? And the answer is protect them the way you have always tried to. And the way you do that is to make sure that you're vaccinated, the people around them are vaccinated, that you are masking, that they are masking, that we are really doing all our due diligence to make sure we protect them, because the ones who can't get vaccinated are relying on us. And my final word is, I encourage people to stop looking for reasons why not to get vaccinated and to figure out that one reason why you should. Give yourself one reason why you should and use that and do it.
Thank you so very, very much. Thank you so much. Dr. Mohammed Reza.
Thank you, Pastor Newman. This has been fantastic, and thank you for including us in this discussion.
Thank you.
A couple of things I just wanted to talk about was these tests, because I've gotten these questions all the time, and we hear a lot of misinformation even from public officials. That antigen test is as good as when you do it and if you're symptomatic or not. So that antigen, that rapid test that you can buy at CVS, Walgreens, you don't want to do that right after you've been exposed or start having symptoms. You want to wait that 3 to 5 days before you even do that test, because you need that time for the nasal pharynx, for the virus to reproduce and actually come back positive, negative. So it will give you a higher accuracy if you wait that 3 to 5 days. If you get it done right within a day of being exposed or symptoms starting, it's going to have really high rate of false negative, even though you have the virus. So first, you want to wait that 3 to 5 days after you've been exposed or you've had or you're symptomatic. If you're not symptomatic, those tests are not very helpful. 50% of the time, you're going to get false negative. So if that test comes back positive, as Dr. Silver says, it's true positive, most likely a true positive. But if it's negative, you want to get that PCR test done, because especially if you're symptomatic. And that's wait at least that 3 to 5 days. You don't want to get it too soon, because it's just going to give you a false negative, even though you have the virus. So that's an important point to get across to parents as they have children coming back from home because they're exposed or they're symptomatic. You don't want to test them right away. You want to wait that 3 to 5 days before you get those tests done. And if that antigen is negative, get that PCR test done, especially if they're symptomatic. The other important point is masks work. No matter what variant we're talking about, they work. I have a 2-year-old, and believe me, it was a struggle to get a mask to stay on a 2-year-old. It took us probably half of his 2-year-old right now to keep that mask on. Now he keeps it on. I just read a book to him before falling asleep. Elmo wears a mask and he loves it. And all of Elmo's friends wear a mask and he intently listened to it. Now he keeps his mask on when he goes outside with siblings. So people ask me, you know what? There's hypoxia that you get with the mask. Children can't breathe. Look at that surgeon that's wearing a mask for 14 hours a day and doing intricate surgical interventions. And I tell patients when they bring up these bogus claims, next time you have surgery, you should tell your surgeon to take their mask off because you don't trust in that mask. It's going to be a malpractice. It's just the reality, because they're trying to protect you because they have you cut open in the operating room. So masks work even for young children, but it has to be taught over time. It's not something that's going to happen overnight, but it has to be modeled by the parents. It has to be modeled by the older siblings. And that's how you get everyone to wear a mask and keep themselves safe, as well as everyone else around them. And now we're seeing the surge in this virus in that pediatric population that we've been dreading. My family, I have 3 little kids, younger than 12 now, make up the most new cases of COVID-19 in Florida, with 127,000 cases just last week. 27,000 cases just last week. Of that, there are consequences. 10 to 15% of children will have long COVID. That's long-term complications. And the other important point I want to make is we don't know the long-term complications because of how new this variant is. So we need to do everything possible to prevent our children getting exposed to this virus. It's not the chicken pox. It's not something else. No, we'll all get it. No, that's a terrible attitude to have. If that happened, we have 350 million Americans in this country. If 1% of those people, everybody got it, look at how many lives we would lose, millions. So that's really a terrible attitude to look at. You want to protect your children, form that cocoon, keep everyone around them vaccinated, wear a mask, protect them as much as you can, especially when they're going back to school, when they're in crowded locations with all these other children that are coming from all these different households. That's the concern that we're seeing, that huge spike in cases in the 12 and younger. And we're going to see inevitably the other thing about this virus. If I catch this virus today, I'm not going to end up in the hospital tomorrow or the day after. There's a process that happens, sadly, and it's going to happen in children too. I get this infection, I get infected today. It'll take me 2 to 14 days for me to have symptoms. It'll take another week or two for me to get sick enough, if I'm going to get sick enough and end up in the hospital. So we're looking at 3 weeks out before you may end up in the hospital. And then if you're going to get intubated, it takes time, meaning where you need a respirator support. We're looking at 4 to 5 weeks out. And sadly, if you're going to die from this virus, we're looking at 4 to 6 weeks out. And Dr. Gill and all the other people in the ICU will tell you this. We try to do everything in our powers possible to keep people alive. And so people getting infected today, we won't see them in the hospital for another 3 to 4 to 6 weeks or die from this virus. That's what people are surprised. Oh my goodness, we have such a huge number of people dying. No, they got sick 4 weeks ago. They got sick back in July, 4th of July. We're seeing them die now because we in the hospital have tried to do everything in our powers possible to keep them alive. So there's a trajectory that we're seeing, and sadly, we're going to see this in our pediatric population as well. It's going to be a lot lower cases, 1 to 2% of those 27,000 children that got infected last week will end up in the hospital. And sadly, 1/3 of those children will end up in the ICU as well. So that's it's just numbers. It's sadly, and that's what it is. And my hospital colleagues in pediatric will tell you that's how it is in the adult world. That's what we saw. That's the barrage of patients we saw. Luckily, it's going down, but sadly, we're seeing an increase in the pediatric population.
Yeah.
On that note, I will stop. Thank you.
Thank you so much. And you're talking about pediatrics, so only perfect segue with Dr. Adriana Cantwell for your final thoughts for tonight.
It's hard to say anything that hasn't already been said, especially I think, Dr. Johnson-Foy, we're all going to be using your words with all of our patients. You said that all so beautifully and so eloquently. And I know that Dr. Silvers shared a little bit about my own family, but what better endorsement can I give to everyone who's listening tonight than to share with you that my husband and we both participated in the Pfizer trial. And we, unfortunately, first time around got placebo. We did eventually get the real thing, along with our other healthcare worker colleagues who were vaccinated in December and January. And then this summer, we were lucky enough to be able to have our daughter participate in the pediatric trial. And so we knew that that was the very best thing that we could do to keep our daughter safe, to keep our whole family safe, and for the betterment of children around the world. I mean, from the mouth of babes, my little one said that the reason she wanted to do this, at that time, the virus was surging in India, and that's what was on all the news outlets. And she said she wanted to do this for the little kids in India to help them. And so if we could all have that courage and that pure heart and love of a child, how much better would our society be if we were all acting from that point of view and that perspective of my job here on earth is to take care of all my brothers and sisters, and to protect each other, because we're all in this together. And so with that, I leave you. The little ones have much more wisdom than we give them credit for.
That is absolutely the truth. Thank you so much. And then finally, Dr. Nancy Statz, the reason why we're here, thanks to Dr. Statz and doctors fighting COVID. Your final words, please.
Well, you overstate the group. Like I say, it's very egalitarian, but I thank you for that. I would just say one small bit is, if you have had COVID or you think you had COVID, you still need to get vaccinated. That's a common misconception, that once you have it, you're good to go forever and ever. And there's a reason we do 2 phases of vaccines. et cetera. I won't bore you with the immunology, but it's better to have the vaccine than to just have the illness. And I would just reiterate Dr. Johnson-Foy's comment was exactly what I was going to talk about, which is people, these younger patients maybe say, I don't need it. I won't get that sick. I'll be fine. And that may be true, but we should try to encourage all of us. We're here to help people. We want you to stay well. Think about who you're impacting by not getting vaccinated. Do you have someone in your life who's under 12 years old that you care about? Do you have someone who might be immunocompromised in your life that you care about? You may not even know that it's someone you work with who's immunocompromised. Is there an older person in your life that you care about? Think about that when you make the personal choice to not get vaccinated, because that impacts all of us, including those of us who just want to utilize our medical system and your own healthcare providers. So thank you so much. I'll end it there. Thank you.
Thank you. And our reach went as far as Maui, Hawaii tonight. So just know that we have people watching literally from all over the world. Let me just say thank you to all of you who participated tonight. And of course, for those who watched and tuned in and sent questions, and great questions, by the way, we thank you. And this was a great opportunity to speak to our community. And you've been watching the Delta variant and the Black community at Town Hall with doctors fighting COVID. I want to thank my illustrious producer, Reverend O. Manigault Newman. Thank you, honey, for helping get this done, or it would not have been done. Trust me when I tell you, trust me on that, guys, it would not have happened. But Pastor John Allen Newman, have been really, it's been a joy for me to be your host tonight. And let me just say this, because I'm not going to make it theological, but I just kind of a little bit say this. There's something that says in the Hebrew Bible, they that wait upon the Lord shall renew their strength, will mount up with wings as eagles, run and not be weary, walk and not faint. Whatever you do, don't get weary, don't faint, gather your strength, because this is in the fight for the long haul. It's not a sprint, it's a marathon. And together, as we lift each other up, catch each other when we fall, we'll make it. And we're going to teach the rest of the world, you make it together. Love wins. Have a great night. Thank you. Bye-bye.
Thanks, everyone.
Thanks, everyone, for joining. Bye-bye. Good job, honey.
Good night. Thank you.
Night.